I'd like to firstly acknowledge the traditional owners on the land we meet today. I'm here in the Bayside region of Melbourne, which is Bunurong land. Bunurong is part of the Kulin Nations. I'd like to acknowledge the traditional owners, their customs, culture, any emerging leaders and any Indigenous people joining us today. I've been lucky enough to have had a range of clinical experiences, including working in the Public Mental Health Service as a senior clinician on the Crisis Assessment and Treatment team. I've also worked in private practice for a number of years since 1999, where I provide individual psychotherapy to individuals with trauma histories, as well as individuals with a diagnosis of borderline personality disorder. In the past, I've also been CEO and clinical director of an Indigenous charity where we delivered a whole range of dialectical behaviour therapy programs to homeless Indigenous youth. I've been well supported in my clinical practice and teaching career, and I've been mentored by Behavioral Tech senior clinicians, Linda DeMith, Cedar Coons, as well as the author of Radically Open DBT, Thomas Lynch. In addition to working with Marsha's senior trainers at Behavioral Tech, I've worked with Babette Rothschild. Babette is the author of The Body Remembers, Volume 1 and 2, and also developed the therapeutic approach Somatic Trauma Therapy. I was lucky enough to teach with Babette in the UK and in Australia, where we taught her trauma therapy intensive program. My very first research project was developing effective interventions for individuals in general hospitals, where I developed a model for consultation liaison psychiatry. This model has been uptaken by a whole range of rural hospitals throughout Australia. I also helped develop the very first mental health nurses in GPs practices program under the Better Outcomes for Mental Health, where we got mental health nurses to provide psychological interventions in a GP's practice. My Ph.D, I examined effective interventions for individuals with a diagnosis of borderline personality disorder. I looked at where was the most effective treatment location, what skills, qualities and attributes clinicians need to hold to be effective providers of treatment to individuals with BPD. And I also wanted to have a look at what therapeutic approaches were effective in treating borderline personality disorder. My current research is done in my clinical practice in Melbourne, where we're examining the effectiveness of a trauma-informed approach to dialectical behaviour therapy. We're running our DBT groups online, and then we're examining how effective these groups are, and we'll be comparing that to the outcomes of previous groups that we've run with dialectical behaviour therapy. So currently I'm providing individual psychotherapy using the model of dialectical behaviour therapy, an approach that I've developed called Stabilisation Based Therapy. So in these approaches, I'm providing treatment to individuals with a diagnosis of borderline personality disorder or complex PTSD. And my programs are delivered both online and in my clinic in the Bayside region of Melbourne. I'm predominantly providing services to mental health professionals, so I'm seeing GPs, psychiatrists, psychologists, social workers and mental health nurses and providing treatment to those individuals. I also provide supervision and support and program development throughout Australia, and I supervise a range of different clinicians as well as DBT teams.